all the participants. Did Robert join?
Not yet, doctor.
He joined 1 hour earlier because in Canada
I'm here, Matt. Nice to see you.
Okay, so
Yes.
we can start. Hello. Sorry, you lost 1 hour of sleep.
It's okay. I was very excited. You can tell.
Okay.
So I will start with sharing the presentation.
So welcome virtually to the MENA Hub for Action Research on Climate Change and Health, March. And you know by now the constituents of the MENA Hub and our major funders, the IDRC and the FCDO. We're happy to really to host you today virtually and to get to know each other, the research teams that we're going to work with for the coming 18 months, and we're going to know more about you now. And we're hoping that this collaboration will continue beyond the stage of the project to the benefit of the MENA region. As you know, the challenges of climate change in our region are huge, and as such, this is not a one activity. So hopefully this will be sustainable in terms of what's needed for the region. So today for our agenda, starting by the welcoming and opening remarks, and then we'll move to an overview of the March Hub, and then the regional roundtable where we'll hear from all the sub-grants about all the sub-grants projects from the teams, and we're excited to hear about from them and to get to know them better, although we have met more than once. And then we'll move to sub-grant management and reporting requirements and what are the next steps, ending with closing remarks and addressing questions. So I give the floor now to Dr. Elia Ael, who's the Vice Provost for Research at AUB, for welcome note. Dr. Ael, please.
Thank you, Dr. Jordi, for the invitation to give the welcome note, and good afternoon to everyone. Good morning for those who are joining us from North America. It is a pleasure to welcome you to the March Regional Virtual Kickoff meeting. I would like to thank our colleagues and partners from across the region, as well as the supporters from IDRC and FCDO for joining us for this event. I would also like to congratulate Dr. Jordi and the March team for bringing together this outstanding network of researchers and institutions from the region. as an institution, we are very proud to support efforts that, support or that promote regional collaboration and address important topics such as climate change. Just to tell you a brief anecdote, we recently, a few months ago, asked our history department to look up the archives for the history of research at AUB. And one of the findings that got us very excited is that the first time research was institutionalized at AUB. So institutionalized meaning that there was an organized effort to have like a pre-award kind of effort, budgeting, reporting, organizing, international collaboration was almost 100 years ago. It was in December 1929. And what's interesting is that this was funded by the Rockefeller Foundation, and it led to regional collaboration. The focus at that time was social sciences, and it was actually the start of the era of social science movement in the region. So this meeting is really in line with that legacy of AUB working with international partners and also partners from the region to make significant change. So again, I would like to thank you for making this happen, Dr. Jordi and the team, and for the partners, funders, and collaborators for being with us in that journey. And I wish you a productive and successful meeting.
Thank you very much. Now I would like to introduce our champion leading the global ARCH hubs throughout. We have 5 hubs throughout the world, and the March is one of them. And it's my pleasure to introduce Dr. Robert McLean, who is the director of all the ARCH initiative, which is advancing research on climate change and health. We're happy that you are with us and working early in the morning to join us. So please, welcoming remarks if you don't mind.
Thank you very much, Professor Jordi. I'm more than excited to be here. I was so excited I was here 1 hour early in Ottawa, Canada, which was 5 a.m. It is though a great pleasure to be here. Thank you for the invitation. I'll introduce myself briefly. My name is Robert McLean. I'm working in the global health team at Canada's International Development Research Centre, which is a funder of research and innovation across the world. One of the major investments we are making is in the field of climate and health. And to advance this investment, we've decided with our partner, the UK Foreign, Commonwealth and Development Office, the British funder of research and development, we have decided to invest in 5 hubs across the world. And we are incredibly pleased with the work of our MENA hub, March, to develop this program here in the region. So the first word I just wanted to say is to kind of congratulate Prof. Jordi and her team, Roya, Hala, and colleagues for how much they have done to establish leadership in this emerging field for the region, which we strongly believe will advance this field globally. To establish an entirely new center of excellence in climate and health research, to set priorities that matter most for the MENA region. I want to offer my congratulations and respect and thanks, but also for the selection, the competitive overview. I hope there's some more sympathy from AUB now for the role of funders in the world of research and innovation, for the selection of the sub-grants to each of you who are here today. I've had the opportunity to look at the applications, and I am incredibly excited, genuinely, about the quality, meaning the relevance, the rigor, the usefulness of the research that's been proposed and selected in the region. This is part of a global movement where we are only beginning to understand the critical and important relationship between the climate and human health. The grants that are being funded in this region are going to be capstone for advancing that movement globally. So my final remark, as Prof. Jurdi noted, is just to say that a reminder perhaps that this is a critical gathering, but you are part of a bigger global family. There are 4 other hubs across Africa, Asia, Latin America, and the Caribbean who you will be getting to know, getting to work with. And I think the work you're doing holds great importance, but for a moment, imagine that that work is connected to equally motivated scientists, equally brilliant researchers working on similar problems across our planet. And I think that holds a great strength, a great opportunity for advancing and for bettering the world we live in. And I look forward to learning from each of you over the years to come. So thank you very much for the invitation and the opportunity to be here. And I'm very excited to hear from each of you. Thank you, Prof. Jurdi.
Thank you very much for always supporting us throughout this process. Your guidance has been very important to us. So about the meeting today, as we said, we have finished cycle 1, research cycle 1, and we have chosen the sub-tentees, and this is the kickoff meeting to get to know more about them and to know more about us. As I said, we have met with them throughout the process, and they've been all working hard since October, so it's now time to celebrate, and it's a major achievement at this point in time that would advance throughout the project, which will continue, the research projects, which will continue over 18 months. And we hope that throughout this process of the EOIs and the proposals and the evaluation and the feedback, we've been helpful to you in terms of not losing interest in applying, although, as you know, all the processes are tedious and take time. But I think the collaboration, I value your collaboration with us and also addressing the feedback and so on. So, and we're always, as you're going to see through this presentation, that this is the stepping stone, and we're moving towards NISA assessment, trying to enhance your research capacities as needed, and we'll try to develop a network for collaboration. So this is the first step now. From now on, it's action-oriented. So to try to have some action within the presentation and the meeting, the virtual meeting. One question that comes to mind for our participants, sub-grantees, what comes to your mind when you think of climate and health? It can be a word, 2 words, a sentence. What comes to your mind? So please scan the code and enter your answer. So please, if we can enhance the response.
I've entered my response, Prof. Jurdi. It hasn't shown up.
Yeah, there might be a problem with Menti. It's
Trying
slow.
to refresh. Yes.
Mm.
I had the same problem. I wasn't able to get to Menti, to get to the website.
Maybe you could enter them in the chat on Teams.
Yes, please. Hala, what's the problem? So
Yes. I'm double checking.
Hala, are you able to go to the responses? Because it says that there's 2 out of 18 that are displayed.
I think it's a connection problem, maybe. It worked now.
okay, can we see?
Of course.
Okay, so we're moving from adaptation, resilience, outbreaks, balance and harmony, emergency action, global issues, immediate responses, not directives, significant worries, disproportionate impact, balance and harmony. You know, I was hoping for planetary health when we were practicing this, because now you know the planetary health, which includes the leveled environment and then the public health, and then you have the global health, and with all the one health approach with all the challenges of climate change. So hopefully we'll move there. So this planetary health. So thank you very much for your responses. So I have 32 responses that have been recorded. Thanks a lot. Okay, move to the second slide, please. Okay, so now the overview of the Marsh Hub. We had indicated in the EOIs, but just a reminder to us, the objective as such, what we want to achieve in terms, we're starting with the vision. So our vision is to advance the environment, sustainable and climate resilient primary healthcare and healthcare systems, with emphasis on primary healthcare, especially those vulnerable to climate stressors and crises, and we're working in the MENA region. So we're hoping to generate evidence-based research, translate the knowledge into policy making, and building the capacity of stakeholders. So this is our vision. Next, please. Okay, so the objective is very critical for us to support the generation and uptake of high quality, gender and equity sensitive evidence to strengthen the resilience, the preparedness, response, and recovery of health systems. So at all stages. So the projected impacts, if we want to enhance the preparedness and adaptation during the crisis, to safeguard the public health, reduce exposure to health risks, and here comes the environmental aspect and the contribution of the health sector also to climate change, and to enhance the ecological vitality. So this is our vision and our objectives. So our team, it's a great pleasure to introduce the Marsh team. So as you know by now, I'm directing the Marsh team. We have Dr. Yasser Abu Nasser, who's a co-principal investigator, and he's part of the management team from AUB National Conservation Center. Dr. Rawia Khudar, the manager of the team and the backbone, Miss Hala Aboud, who's really very active, charming, and does the work without complaining. We've been pressuring her all the time. Sorry, Hala, for this. So the technical
Pleasure,
and
Dr.
methodological support officer, and we have also Ms. Lama Said, that we're missing her photo, and she's our meal officer, and she's also very specific in terms of her capabilities and expanding to the maximum limit what we should be doing. So she's an incentive by herself. Okay, so this is us. In addition, we have our steering committee, and we have some members of the steering committee. I think Dr. Iman Wahid is with us. Dr. Rima Habib is with us. I don't know if I'm missing anyone else. So we have a very good steering committee that is guiding us throughout. And we have a prominent advisory board from the region that is also, we discuss and we discuss major issues, we consult, and they are guiding us through this process. So you can get the CVs and information about them from if you scan the code. So now, how did we reach to the decide on the themes for cycle 1? So Dr. Rawia Khodr will lead us through this, please. Rawia. I can't see Rawia.
I think she got disconnected.
Okay. Okay, I can start by the time Rawia rejoins. So as we were saying that our MENA region is a region which is highly susceptible and already being impacted by climate change. So this is just a brief summary. I'm not going to go through it. So we want to advance environmentally sustainable and climate resilient primary care to reduce climate risks, and this is very critical. We want to enhance the resilience, as I said, preparedness, response, and recovery. And we did a comprehensive study to find out what type of data is available within the region. And also we have the ND GAIN scores for 2025, which will tell us the health vulnerability to climate change in the MENA region. And you have all these countries, and you see that the bar chart, the bars in red reflect on the countries with the highest vulnerability. So this is our region, and it's really critical. If you look at evaluate the ND GAIN scores, situation is not highly promising because we have lots of risks as such. And accordingly, the impacts, whether on fresh water, and this is a major problem in the MENA region, especially in the Arab countries. And this will worsen the migration, specifically due to droughts, floods, desertification, and will fuel conflicts between countries. So we want to try to start acting to minimize the impacts. Second slide, please.
Dr. Jide, I'm back. I have to apologize. My internet is weak, but I can now handle the slides.
Yeah.
So good afternoon.
So I completed the first slide. This is the second one.
Yes, thank you so much. I'd like to welcome everyone to this meeting today. Thank you, Dr. Ael. Thank you, Robert, for being with us. We're very excited to kick off this work. So just to say, I'm not sure where Dr. Judy stopped, but as a broader context, and as we all may be aware that the MENA region is particularly vulnerable to the health impacts of climate change. And this vulnerability is shaped not only, as she mentioned, by rising temperatures, but also by water scarcity, by rising sea levels, extreme weather events, food insecurity, displacement, and broader socioeconomic pressures. And I'm mentioning this because when we're talking about climate change and health in this region, we really need to think about it as a systems challenge. And for March, this is particularly important because we are interested in the implications of these issues for health systems, as also maybe presented by Dr. Judy, and this provides the broader rationale for the March research portfolio. So I'd like to now briefly explain how we arrived at the research priorities that underpin March's work. And we did not develop the themes in isolation. The research agenda was informed by a regional landscape analysis that combined several complementary approaches. So first, we conducted a systematic mapping of the existing research to understand what evidence already exists and the important gaps. Second, we engaged directly with stakeholders and policymakers through interviews and surveys. So we approached around 171 participants from organizations working on climate change and health systems across the MENA region, including stakeholders from countries with different levels of income. And the purpose was to understand not only what the literature tells us or what the evidence tells us, but also what policy makers and practitioners working on the field and also other stakeholders say or mention as important unanswered research questions. And third, we had a regional stakeholder or validation meeting to validate and rank the emerging research priorities. So the March agenda is therefore grounded in both the existing evidence base and also is informed by the perspectives and priorities of stakeholders working in the MENA region. So when we brought together these different strands of evidence, we have two overarching themes and 14 sub-themes that emerged from all of this exercise. Hala, next slide, please. So these are the 14 themes, and we're not going to go over them, but just to say that, as also was mentioned earlier, the research we support, we're focusing on it to be action-oriented and policy-oriented. So we're not conducting here research simply to describe the problem, but also we want to generate evidence that can inform policies, strengthen health systems, support decision-making, and ultimately contribute to climate resilient health systems. And this is part of our agenda and which we will be working with you on it. This exercise and the themes and the sub-themes brought us to two main themes that we selected for this first March research cycle. As mentioned, we're in the first cycle, but soon we will also launch a second research call in alignment with the broader research agenda of March. So the first theme focusing on assessing the health vulnerability to climate change and crises and evaluating climate-related emergency preparedness in the MENA region. And this theme is fundamentally about understanding vulnerabilities and preparedness, and it has a regional dimension. So the research team that we'll happily introduce later on will tell us more about how we approach this research question. And the second theme is about enhancing the capacity of the primary healthcare system to deal with climate change and crises in the MENA region. And this theme brings us closer to case-specific studies. And as you can see, they are complementary. And as mentioned, they contribute to the broader March agenda and objective. So this is the foundation on which our first research cycle is. We now have 5 research teams who are with us today across Lebanon, Jordan, Egypt, Palestine, and Morocco. And over the coming 18 months, we will be working together not only to generate high quality research, but also to strengthen this regional learning and collaboration to produce evidence. And with that, we'll move on to the presentations from our research teams. Just before that, I'd like to note that the order of the presentation is alphabetical based, and based on the names of the last name of the PI of each research team. So with that, we can start with Dr. Al-Bitaini, Mohammed Bitaini, from Yarmouk University, Jordan. Dr. Bitaini? The floor is yours. And also, I'd like to note, please, that we have 5 to 10 minutes max for each presentation. So hopefully we can arrange around that time as well.
Good afternoon, everyone, and thank you so very much for this opportunity. We are excited to begin. I'll try to make it brief as much as possible. So can you go back to the first slide? Just want to read off the title. So climate health vulnerability and emergency preparedness in the MENA region. This is a multi-country equity-centered project led by the Yarmouk University out of Jordan. Next. I'd like to introduce the team. And so as I mentioned, this project will be led by the Yarmouk University, surrounding environmental epidemiology, climate health modeling, health system preparedness, and policy transition, centered in gender equality, social inclusion, and community engagement. Dr. Ruba from Yarmouk University in Jordan will be our gender inclusion and social, gender equity and social inclusion from Yarmouk University. She is the former director of the Refugee Displacement and Forced Migration Center in Study Center in Yarmouk University. She is specialized in refugee studies, forced displacement, and mitigation governance, and vulnerability, gender equality, and crisis responsiveness. So she will be our GESI lead. We also have Dr. Hiba Al-Haj, who I believe is on this call, from the American University of Beirut in Lebanon. Dr. Hiba is an associate professor at the Department of Experimental Pathology, Immunology, and Microbiology at the Faculty of Medicine at AUB. She is a biomedical engineer and translational scientist with extensive experience in molecular parasitology, host pathogen interactions that are very much related to climate change and health in the MENA region. We also have from Dr. Wijdan from the University of Susa in Tunisia. Dr. Wijdan Mansour is an associate professor of microbiology. She's a clinical and environmental microbiologist with deep expertise in AMR, One Health, as well as infectious disease surveillance. We also have Dr. Hakima from University of Batna in Algeria. Dr. Hakima is a clinical veterinarian and a microbiologist, and she will bring in a specialized zoonotic bacterial pathogens, infections related, as well as AMR and foodborne diseases epidemiology within livestock production systems, encompassing the One Health approach. And definitely last but not least, we have Professor Huda from University of Aden in Yemen. Professor Huda is a practitioner and a public health consultant for various outstanding international and national recognized entities. And she has a particular experience in women and children's health. And Professor Bassem Saddiq from Khalifa University, United Arab Emirates. She is the chair of the epidemiology and public health with extensive experience in communicable and non-communicable diseases, particularly with environmental and occupational health risk affecting the mobility population. And both Yemen and United Arab Emirates will serve as our comparative lens for climate fragile and high-income countries. We do have our consultant and senior advisors, Professor Munjid Al-Sharif from German University in Jordan. He will serve as our technical oversight for climate hazard modeling, environmental exposures, and vulnerability assessment. He brings into the table extensive experience in and working for various advisory committees and climate resilience health systems, as well as Professor Muawiyah. He is a professor in public health and the Dean of Scientific Research and Graduate Studies at Yarmouk University in Jordan. And he will serve as a senior advisor for emergency preparedness, epidemiology surveillance, and policy transition. And last but not least, we have Professor Ofa from University of Carthage in Tunisia. She will serve as senior consultant related to water reuse, emergency contaminants, and One Health linkages. And all the consultants will serve and contribute to specialized technical depth within their countries and to contextualize the relevance and policy uptake for this presentation. Next. So the project overview, and the idea was to transition this from a static assessment to an integrated model for climate health and vulnerability and preparedness and data systems in the midst of all the rising challenges and the risks from heat, drought, air pollution, to the fragile infrastructure and inequities. So we try to make this, why this project matter, to link the climate hazard and social vulnerability together, and using these as an integrated framework spanning over 6 countries over the period of the project, utilizing the objectives of the project. We will be utilizing the updated Jordan's Health National Assessment Plan, vulnerability and this assessment indicators, and harmonize this with all the partner countries, including gender, displacement, and occupational socio-economic inequities. We will also evaluate the emergency preparedness and readiness. This will be done primarily in Jordan, and then harmonize across all participating countries. And then probably the most exciting, develop and pilot the Climate Healthier platform, utilizing and linking the meteorological data with the Ministry of Health, trying to interpret a dashboard for decision support framework. And eventually, we are hopeful that adapting this framework across various system contexts and operationalize this spanning from Yemen to the United Arab Emirates, and harmonizing the regional framework covering all the other 4 countries, Jordan, Lebanon, Tunisia, and Algeria. Next. And as I mentioned, the topology and the study scope will span over 4 middle-income countries, Jordan being the in-depth focus of the study, Lebanon, Tunisia, and Algeria as harmonizing national vulnerability and preparedness benchmarking, and then utilizing Yemen as fragile conflict affected for Objective 4, and high-income United Arab Emirates to recalibrate the indicators for high-capacity, digitally ready systems. So that's how we envision the study to be conducted, and this will be applied across all 6 countries. Next. The methodology and the implementation will start the first phase with the climate health vulnerability assessments, compiling data from the Ministry of Health, the meteorological department, the demographic, the displacement, and the social economic data. Build this together and try to produce a government-level hotspot mapping for cross-country benchmarking. And then we will transition to emergency preparedness and readiness, assess these data from the centralized platform in the Ministry of Health in Jordan, survey and audit some of the health workers, and review preparedness systems and the partner countries. And eventually, in the third phase, we platform quantitative inquiries and policy transition, conduct these interviews and focus groups, and ultimately produce a climate health dashboard with data linkage framework, moving from a static to more proactive dashboard. Next. So the theory of change is we bring in the inputs and the activities that we incorporate in the study from the various items that I've mentioned before, and ultimately arriving to certain outputs and outcomes, identifying the hotspots, the Do Health National Program integration, and ultimately arrive to our long-term goal, which is probably going to span beyond the funding period to a climate resilient, equitable primary healthcare in Jordan and in the MENA region at large. Next. And this is a special area of focus for the gender program marker for gender responsiveness, in which we will incorporate over 50% of women and over 30% of inclusion of displaced and disadvantaged populations embedded throughout all the 3 phases of the study. Next. And ultimately, the expected outcome, impact, and the translation. We will aim to do vulnerability mapping, readiness profile, dashboarding, and policy and learning outcomes. So this will translate into policy briefs, interactive dashboard, peer-reviewed publications, obviously, regional webinars. And in my opinion, probably one of the most important one is to bring in this to a plain language in Arabic for dissemination across communities and hopefully implementation and make it better. And then hopefully the impact will be into area identification of high risk, better alignment, more equitable and scalable model for beyond the funding period. So overall, the main contribution of our proposed project is to move it from a rather a reactive crisis management toward more of anticipatory, inclusive climate healthcare governance. And that's our, hopefully our main contribution to this project. And I would like to thank you for maybe a little over 10 minutes.
Thank you so much, Dr. Bitaini. So Dr. Bitaini is handling team 1 of our project. We're gonna move to theme 2 research teams, which is about the PhDs. And we're gonna start with Dr. Angie Rigitani.
Good afternoon, everyone. It's a great pleasure to join you today. And first, I would like to thank the Marsh team and the American University of Beirut, IGRC, FCGO, and for this opportunity. And we are very pleased to be part of the first Marsh research cycle. And we look forward for working during the project and beyond, and also learning from all parties and teams. Our project is entitled Climate Resilience and Primary Healthcare System Preparedness in Egypt, with a special focus on workforce capacity, facility readiness, and inclusive service delivery. Next, please. Next, please. Okay, the project is led by the High Institute of Public Health, Alexandria University, and I serve as the principal investigator. Next, please. As for the team for the project, we have deliberately brought together a multidisciplinary team because, as you projected earlier, that climate resilience in health system cannot be addressed from one discipline or single disciplinary perspective. So our core team combines expertise in public health, primary health care, epidemiology, research projects, leadership, and implementation in health systems, and these are represented by the core team, Dr. Iman, Dr. Nurhan, and Dr. Abdurrahman, who is the General Director of One Health Department at Ministry of Health and Population, and this is a special linkage to the Ministry of Health and Population, which is mandatory in these regards. Next, please. And the core team is complemented by a panel of experts from different also backgrounds and expertise, including climate change and GIS by Professor Mahmoud Adel, global and migrants health from Professor Sally from St. George University of London, also Dr. Farah Sidat from that is expert in evidence census and policy translation, and also Stella from IS Global Barcelona for qualitative and participatory research, Associate Professor Aifat from United Arab Emirates, expert in qualitative research and Jesse, and also Professor Samar for quantitative research and epidemiology. Next, please. We actually plan to work closely with national organizations, particularly the Ministry of Health will be coordinated by our co-researcher, Dr. Abdurrahman, and also international organization and particularly WHO Egypt, and will be represented by Dr. Sadna and Dr. Gasser, and also other UN organizations like UNGRR and UNHCR, and most importantly also is the community organizations. Some collaborations already established, while others are currently being explored. As we want the project to be developed with the health system and affected communities rather than simply by the research team. Next, please. Okay, so what is the project about? The core principle or the core problem that the project is going to tackle is the climate-sensitive health threat, which is increasingly affecting the populations and placing pressure over the health systems. And yet climate risks are not always systematically translated into everyday preparedness and service delivery of primary healthcare. So which the primary healthcare is often the front line or the interface between the providers and the consumers, particularly in the era of universal health coverage application. So our project therefore focuses on three interconnected dimensions: the workforce capacity, the facility readiness, and the inclusive service delivery. And over the 18 months of the project duration, we will move through a deliberate pathway from evidence to co-design to real-world implementation through piloting our product. We will generate and synthesize evidence and map climate health vulnerabilities, assess the preparedness, examine policy governance gaps, and work with the stakeholders. And the central product bringing all these different components together will be the climate resilient primary healthcare toolkit. Next, please. Next, please. So our research has 5 main objectives. First, to identify climate-sensitive health threats and assess vulnerability together with the primary health care workforce and facility readiness. Second, to understand the policy and governance environment, and not not only to just study this, but also to note the extent to which these considerations are currently integrated into the planning, into primary healthcare planning. Third, we to use evidence to co-develop the climate resilient primary healthcare toolkit. The fourth objective is to pilot the toolkit in real primary healthcare settings and assess its feasibility, acceptability, adaptability to in the real world. And finally, to translate the resulting evidence into policy uptake and knowledge exchange across within Egypt and across the MENA region. Next, please. So how we will do this methodologically? We will our approach is a mixed method participatory action approach, and we'll go through 5 interrelated phases. We start with evidence census and situational analysis. This includes systematic evidence review alongside the secondary data analysis and GIS mapping. An important product from this phase particularly will be the Climate Health Population Primary Health Care Vulnerability Atlas. And this atlas will bring together information on climate exposure, population vulnerability, health risks, and primary health care capacity. In parallel with this phase, the second phase is that we will conduct a policy and governance analysis, including key informant interviews, to understand not only what policies exist, but also where the practical opportunities and barriers for implementation lie. Next, please. Okay, then we'll go from evidence that were generated in the earlier phases to the co-design. And also the central part is that the researcher will not co-design the intervention themselves, but after evidence census, with the help of our stakeholders, we will co-develop the toolkit, and this will be done through 3 multi-stakeholders workshops, where we will bring together health professionals, decision makers, technical partners, and community stakeholders for the co-production of the climate resilient toolkit to be not only evidence informed, but also putting into consideration the feasibilities, applicabilities, the context of the real situation of the real situation of the primary healthcare units in Egypt. Okay, next, please. Then we'll go from co-design to real-world implementation, which will be implemented through a pilot study. 3 to 5 primary healthcare facilities will be selected using the climate health vulnerability and primary healthcare preparedness criteria and mapping we developed earlier. And putting into consideration the population vulnerability, feasibility, and diversity also of settings. The selected toolkit components will be implemented and will be evaluated also using a combination of facility assessment, provider measures, and feedback from both the staff and service provider and also the consumers. And then this will allow us to understand simply whether an intervention work, but also whether it is feasible and acceptable, adaptable within the routine practice. So the final phase is the knowledge translation, where we hope to make a national dialogue. So we have a plan for implementing our modified toolkit on across Egypt, and then set up also a scale-up pathway for applicability over across the MENA region. Next, please. This is a demonstration of the climate resilient primary healthcare toolkit. Will include many components, including the workforce with their capacity and occupational safety and well-being, climate sensitive health responses, the wash and health care waste, sustainable energy and service continuity, infrastructure and patient flow, and this will form like an inclusive primary healthcare toolkit, not only like a another research report. It will be an operational guide for to be ready for implementation and consumed by the providers and managers for the primary health care. Okay, next, please. Okay, as for the outputs. The outputs include the atlas we mentioned before, the Climate Health Primary Healthcare Vulnerability Atlas, evidence on preparedness and workforce facilities and system readiness. The toolkits, which is, as I mentioned earlier, the central product of our project, and also the pilot implementation evidence, and then the modified toolkit. And we will develop 2 policy briefs, and evidently also we will develop systematic reviews and publications all through the steps of the project, and also finally knowledge products and exchange in national policy dialogue and regional webinars. We have an ultimate goal. Next, please. Going through this journey from mapping to understanding to co-design, testing and translating, and then scaling the output of the project, we ambitiously want to have a stronger primary healthcare workforce preparedness, more resilient and sustainable and inclusive and equitable services for service users, and also evidence translated into policy and scalable action within Egypt and across the region. Thank you so much.
Thank you very much. We'll move on with our Morocco team, research team, Dr. Mohammed Khalis.
Hello, everyone, and it is a great pleasure and happy to join this program and happy to work with you over this program. And I want to thank first all the March program and team and AUB university team and all founders. The title of our project is Building Climate Resilience Primary Healthcare, Co-Developing Gender Response Workforce Training and Facility Intervention in Morocco. Next, please. Yeah, next, please. This project is led by the Mohammed VI Foundation of Science and Health through the Mohammed VI Center of Research and Innovation in Rabat. And our team is multidisciplinary team with complementary expertise, bringing together expertise in epidemiology and public health and the climate change, environmental health, gender equality, quantitative and qualitative method and implementation and participatory approach. The team will be led by me, the PI of the projects. I'm professor of epidemiology and public health, and I'm the head of the Department of Public Health at the Mohammed VI Center for Research and Innovation in Rabat. And we will have the experts on climate change with us, the Dr. Kanza Khomsi. We have also Dr. Rashid Boutayeb, expert in gender equality, Dr. Omnia Bouaddi, that is researcher and expert in participatory approach and qualitative research, Dr. Najwa Al-Mshabbak also, that is a researcher expert in public health, and we have assistants in the working in focusing on environmental health. We have with us Mrs. Afaf Hmimsa, Mr. Muad Aderbaz, and Dr. Omnia, that is medical doctor and also experts on climate change. In this, we have a collaborator also from Ministry of Health and UN agency UNFPA that's well collaborates in this project with us in this project. Next, please. Why this project? Morocco is experiencing increasing climate-related challenge, and this challenge can affect not only the health of community, but also the health or the well-being and working condition of primary health professional. And actually, there is currently a limited evidence in Morocco on how, for example, climate change affect the physical and mental well-being of professional health. Primary healthcare professional, and for how climate-related conditions affect their working condition and ability to deliver care, the level of climate health knowledge, preparedness and capacity among primary healthcare professionals, the climate resilience and environmental sustainability of primary healthcare facilities, and how this impact differ according to the gender, age, socioeconomic circumstance, and geographic location. Next, please. The overall aim of this project is to generate evidence on the gendered impact of climate change on the primary healthcare workforce and assess the capacity of primary healthcare professional to respond to climate-related challenge. And our approach will be first understanding, then co-design, and after that pilot and evaluate. We have three main objectives. The first one is to understand first the context and the problem, well, explore how climate change affect the health, well-being, working condition, and services delivery capacity of primary health care professional. And at the same time, we will assess their knowledge, attitude, perceived capacity, coping strategy, and capacity building needs, as well as the resilience of their facilities. The second objective will be the co-designed solution. Based on the finding, we will work directly with primary healthcare professionals to co-develop a gender responsive intervention package. The package will combine workforce training and low-cost facility-based intervention. The third objective will be pilot and evaluate. The intervention package will be implemented and in selected primary healthcare facilities to assess its feasibility, accessibility, and preliminary effectiveness. Next, please. Next. Next, please. Yeah, thank you. We will have the second work package here Yeah, can you go back, please, to be sure that is this next? Back, please.
This slide for package one.
Yeah, yeah, for package one, it is. Yeah, we'll talk about the methodology. This project, you will use the community-based participatory research approach, answering that primary healthcare professional contribute to the research process and to developing of solution. We have two work package. The first one is with the objective assessments. We will conduct a cross-sectional survey of 500 primary healthcare professionals in 3 regions to assess climate health, knowledge, attitude, perceived capacity, health and well-being, working condition, facility resilience, and environmental sustainability practice. And also will conduct approximately 15 to 12 qualitative interview per region to understand the lived experience of healthcare professional and explore issues that cannot be fully captured through a survey. Next, please. The second package will be co-design. We will organize 3 co-design workshops involving approximately 12 primary healthcare workers per region using Stanford design thinking framework, and participants will identify priority, develop training, contents, and help select feasible facility-based intervention. Then the intervention package will be piloted approximately in 12 primary healthcare facilities, and we will assess change in knowledge and practice and identify facilitators and barriers and adaptation required for implementation. Next, please. Expected output. This project will generate both evidence and practical solution, will generate evidence on how climate change affects the health, well-being, working condition, and service delivery capacity of the primary healthcare workforce. We will establish a baseline climate health knowledge, attitude, practice, capacity gaps, and facility resilience among primary healthcare professionals. Training, gender response training program. We will have also low-cost facility intervention and pilot evidence, and later we will have translates the download to publication. This project will product scientific publication and policy brief and dissemination activity to facilitate the use of funding by policymakers and health system stakeholders. Next, please. Yeah, the impacts. For the impact, this project is expected to generate impact at several levels. For healthcare professionals, for example, they will have improved knowledge, skills, and capacity to respond to climate-related health challenge. For example, the health system, the projects will provide evidence and tools that can support climate resilience, primary healthcare planning, and policy developments. For gender equity, the project will identify and address gender and intersectional vulnerability, and ensuring that climate health intervention respond to different needs and experience. Yeah, and for the scale up, the intervention package will be evaluated so that successful approach can potentially be adapted and implemented in additional and other primary healthcare facilities and other climate stressed region of Morocco. And thank you so much. Next, thank you.
Thank you very much, Dr. Khalis. We move forward with Dr. Maysa Nimr from our team in Palestine.
Hello, everyone. I would like to begin by thanking the March team at the AUB for organizing this kickoff meeting and for bringing together researchers from across the MENA region. I would also like to express our sincere appreciation to the funders for this initiative, for supporting research that addresses critical climate and health challenges in our region. We are actually very pleased and excited to be part of the March community and to be among the first round of funded teams. And we see this as an important opportunity, not only to implement our project in Palestine, but also to learn from other sub-grantees, exchange experience, and contribute to the regional knowledge and collaboration. So our project focuses on strengthening the resilience and sustainability of primary healthcare in Palestine by protecting and empowering the health workforce. I will briefly introduce our team and then talk about our project. Next slide, please. So starting with our project is led by the Institute of Community and Public Health at Birzeit University in the West Bank of Palestine. The Institute of Community and Public Health at Birzeit University is a leading academic and research institution committed to generating context-relevant evidence on priority public health challenges in Palestine. ICPH combines interdisciplinary research expertise with extensive experience in capacity building, supporting health professionals, researchers, institutions, and communities through education, training, and mentorship. Talking about our team, our core team is composed of 2 people, which is myself as a principal investigator. My name is Maysa Nemer. I'm associate professor of public health, specialized in occupational and environmental epidemiology, and I am also I work as the head of the environmental and occupational health unit at the institute. I am an occupational epidemiologist with the extensive experience in environmental and occupational health, climate change and health, mixed methods research, and health system resilience. And as the project principal investigator, I will lead the scientific implementation and support the translation of findings into practical interventions and policy recommendations. The co-principal investigator of the project is Dr. Mais Araj, who is also with us today. She is an academic researcher at ICPH as well, and her expertise includes the public health, health systems, equity, and participatory research. So within this project, she will also contribute to the research design and implementation, stakeholder engagement, data analysis, and the co-development of context, responsive interventions and recommendations. The wider project team will also include several other colleagues, including research assistant, trained field workers, analysts, monitoring and evaluation, expert gender expert, data management expert, and specialized trainers who will also work closely. The whole team will also work closely with the Ministry of Health and primary healthcare stakeholders. Next slide, please. So moving to talk about the project overview and why and how this idea came. So as we know, climate change increases both the health needs of communities and the pressure placed on the health system and specifically on health workforce and facilities. So primary healthcare workers are expected to sustain essential services during emergencies, often without adequate training, protection, or institutional support. And in Palestine, climate-related pressures interact with other challenges, pre-existing challenges, including the occupation, movement restrictions, resource scarcity, and health system fragmentation. So this idea came actually from our recent previous project, a research project on health system response to climate change, which identified important gaps on workforce preparedness, occupational protection, and context-specific operational protocols. Therefore, this project responds directly to those findings and to prioritize and the priorities raised by the national stakeholders. Next, please. So moving to our research objectives, our overall aim is to assess, strengthen, and protect the primary health care workforce while supporting the continuity of essential health services during climate-related risks and crises. Our objectives follow an evidence-to-action pathway. We will first assess the preparedness and occupational risks, then strengthen workforce capacity, improve institutional safety practices, and co-develop practical tools for service continuity. And finally, we will translate the findings into recommendations for policy and institutional planning. Gender equality, social inclusion, and intersectionality will be all integrated throughout the project rather than treated as separate activities. Next, please. So talking about the theory of change, our starting point is that the Palestinian primary healthcare facilities and their workforce face growing climate risks amid political instability, resource constraints, institutional fragility, and workforce pressures. The change pathway will, throughout the project, will combine participatory, context-grounded, and gender-responsive research with stakeholder engagement to generate actionable evidence and co-develop targeted workforce training, climate-resilient protocols and guidelines, occupational health and safety measures, institutional preparedness and continuity mechanisms. And the expected outcome will be a safe, better prepared, and more climate resilient primary healthcare workforce supported by stronger institutional capacity to sustain equitable essential services. Next, please. Okay, so talking about the design and methodology, we will use an 18-month mixed methods participatory action research design. The study will cover 12 primary healthcare facilities across the north, middle, and south of the West Bank, and will represent different geographical and socio-political settings, including urban, rural, refugee camp, and also a climate vulnerable population and Area C settings. The first phase will generate evidence through facility. No, please, yeah. The first phase will generate the evidence through facility assessment, surveys, and approximately 120 primary healthcare workers, 20 to 25 interviews, and 5 focus group discussions. In the second phase, we will translate the evidence into action, and it will include pilot training for approximately 36 primary healthcare workers, and also an experience-based co-design process involving 3 stakeholder workshops and 3 regional reflection sessions. These activities will be used to develop and refine practical protocols, checklists, and guidelines. And at the end, the quantitative, qualitative, and participatory findings will be all triangulated with the gender disaggregated and intersectional analysis applied throughout. Next, please. Now, talking about the expected outcomes, the project is intended to produce practical outputs, not only research findings. So it will include the outputs related to evidence and learning, including the primary healthcare workforce and facility needs assessment report, context-specific climate and health training package. In terms of capacity and operational tools, it will include the training packages, the occupational safety measures, and the climate resilience protocols and guidelines. And of course, we will have policy and knowledge translation tools, including policy briefs, technical reports, academic publications, and other knowledge sharing and public communication products like infographics, videos, and fact sheets. And finally, talking about the projected impact. So we anticipate impact at several levels. At the workforce level, the project should improve preparedness, safety, and resilience. At the institutional level, it should strengthen occupational health practices, readiness, and continuity mechanisms. While at the policy level, it will support stronger integration of workforce protection into climate adaptation and health system planning. And because frontline workers, the Ministry of Health, and the other stakeholders will participate throughout the research, the resulting tools should be better positioned for institutional ownership and scale up by them. We also hope that the project will generate lessons relevant to other fragile and resource-constrained settings across the MENA region. Thank you so much, and we look forward to learning from and collaborating with the other teams. Thank you.
Thank you very much, Dr. Nimr. We're a bit behind schedule. Your presentations are comprehensive and very interesting to stop you, to be honest. So we'll move on with our team from the Global Health Institute. I'm aware that Dr. Saleh, who's the PI, is not with us, but maybe Mrs. Mehdi will present on his behalf.
Yes. So, good afternoon, everyone. I'm Nurhan Faidli, and I serve as the CLI Health Program Manager at the AUB Global Health Institute. And I have with me today Ms. Noor Al-Arnaout, also she's the Associate Director of AUB GHI. And on the behalf of my team, I would like to thank you for this opportunity, and we are looking forward for this collaboration. So our project is entitled Empowering Primary Healthcare Workforce to Respond to Climate-Related Crisis, a Capacity Gap Assessment and Tech-Enabled Intervention in Lebanon and Jordan. Throughout this project, we aim to assess and strengthen the capacity of primary healthcare workforce to prepare for, better respond to, and ensure a continuity of services during health crisis induced by climate. So next slide. So I'd like to introduce you to AUB GHI, which is the lead institution on this project. So GHI was established in 2017, and it's the first institute of its kind in the MENA region and among the very few in the Global South addressing global health challenges through an interdisciplinary and contextualized approach. So our work is grounded in an interdisciplinary and locally driven approach that is tailored to the communities that we serve. Combining research, policy, innovation, capacity building with a MENA regional focus. The project will be implemented through one of GHI's 6 operational program, the CliHealth program. The CliHealth program at GHI leads research and action at the intersection of climate change, health, and health systems resilience across the MENA region. Next slide. Okay. So the project brings expertise from the region. As I told you, the AUB GHI is the lead institution on this project, led by Dr. Shadi Saleh, the founding director of AUB GHI, as the principal investigator on this project, who will lead the implementation of the overall project and specifically the implementation in Lebanon. The Eastern Mediterranean Public Health Network from Jordan will be our implementing partner in Jordan, led by Dr. Muhannad Nsour, who will support the implementation of the project in Jordan, represented today also by Dr. Randa Saad, which is with us also. And Dr. Kanza Khomsi will be our climate and health advisor, who will give us like a guidance on the climate dimension and the technical and science dimension of the project. Also, the project will be supported by the research and operational teams at both ABGHI and ANFLET. So our research objectives revolve around assessing the PHC workforce knowledge and capacity gaps in terms of climate-induced health challenges, and to evaluate the effectiveness of an existing professional development mobile application at ABGHI after adapting its content in enhancing the PHC worker knowledge on climate-sensitive health risks, their preparedness in terms of emergency responses, and the continuity of care during crisis. Also, we seek to generate evidence and policy recommendations for climate-resilient workforce professional development and hopefully scale up the solution into other places in the globe. Okay, so the project is formulated around 18 months, will be implemented throughout an 18-month time frame through a mixed method approach structured into 2 phases. The phase 1 is a knowledge and capacity needs assessment. Throughout this phase, we'll understand the current knowledge in terms of climate health knowledge, preparedness in terms of emergency response, planning, and so on, training needs of the workforce, and barriers to trainings among primary healthcare workers and within the health facilities in itself. The findings from phase 1 will adapt the implementation of phase 2, which is a digital intervention and evaluation phase, in which we will be employing and evaluating the effectiveness of an existing AUB GHI AI-powered capacity building mobile application after adapting its content and enhancing the climate change and health knowledge using a single group pre-post design. So looking more closely into phase 1, we will be engaging with physicians, nurses, and administrators throughout selected primary healthcare centers at both of Lebanon and Jordan. We will conduct knowledge and capacity needs assessment surveys guided by the WHO operational framework for climate resilient and environmentally sustainable healthcare facilities, also by the WHO operational framework for building climate resilient and low carbon health systems to understand the climate health knowledge, preparedness, the workforce ICT readiness, and the level of resilience amongst the facility. This would be complemented by key informant interviews to better understand the systemic barriers, workforce challenges, and training needs. The findings will inform the adaptation of the intervention through co-designed workshops in both of Lebanon and Jordan. So phase 2 will start by a baseline assessment. It's like a case study assessment to assess the baseline knowledge and preparedness and practices related to climate health before any intervention. And then we will administer the intervention throughout an 8-month of digital capacity building, throughout which our participants will engage with the AI-enabled mobile application featuring interactive lessons and real-world scenarios. After adopting the intervention, the participants will be the knowledge of the participants will be evaluated through the same baseline knowledge assessment in order to evaluate the change in the knowledge that happened due to the capacity building intervention, coupled with user satisfaction surveys to give us an overview of the overall satisfaction, impacts, and opportunities for scaling it up. Next slide. So throughout this project, we expect to generate a comprehensive assessment of climate health knowledge gaps, workforce needs, and institutional barriers in terms of climate-induced health challenges. We also aim to generate an evidence on the effectiveness of an AI-enabled learning application in improving the PhD workers' climate health knowledge and preparedness. And also we aim to generate evidence-based policy recommendations to support the national workforce professional development strategies that are at the front line of any climate shock. So ultimately, this project will be a transferable model for digital climate health capacity building for PhD systems that can be scaled up across the MENA region and beyond. Thank you so much.
Thank you very much, and thanks everyone for your very interesting presentations. So now we'll move on to the next session. We have a question for you, but I'm not sure for the sake of time we would move forward with that. What do you think, Dr. Jirde?
I think we should move. We can get feedback from the teams on this question and save the time for now. What do you think? So we can send it by email and ask for suggestions, and then we can compile them.
Yes, I think that's good, and we'll try to be quick in our presentations, so we will remain on time, hopefully. So now the session is on subgrant management and reporting requirements, and this is an important session as we move into the implementation phase of the Cycle 1 projects, and this is to make sure that all research teams have a clear understanding of the clear requirements related to their subgrant agreements. And we'll also leave some time at the end for an open Q&A, depending on how much time we still have. So to start us off, we'll have Mrs. May Ammar Awar Ammar, sorry, yes, and sorry to keep you waiting. Mrs. Ammar is the Director of Sponsored Programs and Technology Transfer at the Office of Research at AUB, and will give us an overview of the subgrant agreement and the key points that you need to be aware of. Thank you, Mrs. Ammar.
Thank you, Rabia. So, hi, everyone. It's a real pleasure to be with you today to really showcase and share with you what we do within the Office of Research to really ensure the part of the core structure of the subgrant agreements that govern our work under the IDRC March Hub. What we do and how we do that is we operate within the office in an agile manner. We are not mere gatekeepers. We consider ourselves as enablers next to our researchers and next to the March team to really ensure this part of the job is really reflected. The part where the subgrant agreements, we consider these as the foundational framework that protects your institutions, that safeguards research integrity, ensures smooth operational delivery over the life cycle of the project. So within this framework, I'd like to highlight 3 primary elements that should be kept in mind as we move forward. The importance of having clarity over roles and responsibilities, because the subgrant agreement really establishes the precise scope, timeline, administrative expectation for each subgrantee, and understanding these terms early prevents ambiguity down the line. What we also make sure, because this hub is supported by IDRC and FCDO, certain mandatory donor provisions ranging from financial management standards to research ethics, they really flow down directly to your institutional contracts, if you notice, through the grant agreements. So we want to ensure compliance. We want also to ensure that having the Office of Sponsored Programs that operates under the Office of Research at AUB is not just a compliance checkpoint. We make sure roles and responsibilities are clear. Compliance checkpoint is ensured, but also we are here to support the team when changes occur in project timelines, in key personnel, or even operational environments. You know, we operate in challenging contexts. So this too, also we keep an open and timely communication, allowing us all to process necessary amendments as we go in a seamless way. So if we can move to the next slide, please, where I will walk you through the key clauses, if we can say, the main contractual focus areas. The first one is the amendment, where how do we manage project scope and timeline changes? So we're very proactive on this level. When any material change is needed to the approved scope of work, when any change in key personnel, major budget line adjustments, these all require prior formal approval, and these will fall within amendments that we need to put in place. So the way we do that is we be vigilant. You need to make sure this is communicated to us. Amendments cannot be backdated, and this is controller's procedures and an institutional requirement. So sub-grantees must notify our office as soon as a delay, deviation, or shift in activities is anticipated. Sometimes also during the lifetime of the project, well, depending on project milestones, you might need no-cost extensions. So because of delays due to external circumstances, and these also must be submitted, we must be flagged so as to ensure that we put that or this within the framework of an amendment that is accompanied by a clear revised timeline and spending plan. The other focus area we look at is absolutely and surely the intellectual property part. You know that intellectual property generated during the project generally remains with the respective sub-grantee institution, but also is subject to donor requirements. So we make sure we align on this. We make sure when research outputs, publications, underlying data sets really comply with IDRC's open access policy, and we really also make sure that any pre-existing intellectual property brought into the project by a partner institution remains also exclusively theirs. Now, another focus area we look at is the risk mitigation and flow down. Now, risk mitigation, absolutely, because as we all know, this is a complex regional context. Agreements include provisions for suspension or modification in the event of unforeseen force majeure, regional disruption, safety concerns, events. So early operational transparency allows us all to safeguard both the research team and the grant funds. So we want to make sure we're aligned also and communicate on that. Now, in terms of flow down, and we speak of flow down in grants management when we give out sub-award agreements, and here these are requirements, like for example, in this case, that IDRC or FCDO have, and we want to make sure the flow down compliance to the sub-award also is ensured because it's mandatory. And these can include anti-corruption, counter-terrorism, sanction compliance, research ethics standards, all apply directly to sub-grantees. And we also look out for the requirements to retain all technical, financial, and procurement records, usually between 3 to 7 years, archives for auditing purposes. So record retention for auditing at any point in time during this time period. So this is grosso modo, in a nutshell, what we look at while we're managing these sub-award agreements. Thank you.
Thank you very much, Mrs. Ammar. So again, we may have I'm suggesting that maybe you can write your questions in the chat box, because we may not have a lot of time to answer questions. So if you have any questions to Mrs. Ammar, please drop her a question in the chat so we so she can reply. And I'm sure she has other commitments. I'm not sure you will be able to stay with us till the end, right?
Yes, yes. Unfortunately, I have another online meeting at 4, so I have to prepare.
So if you have any, if you have any questions, please drop her a question now. Moving on, I'll briefly walk you through the key deliverables and reporting milestones that the research teams will need to also keep in mind during the project period. And as also outlined in your contracts, first by August 31, we asked you to please submit 4 initial documents, and you have their templates. We've sent you their templates through our email, our March email. So one is about the work plan, the second is about risk management plan, third, open access and data management plan, and fourth is the safeguarding checklist. Dr. Jildi will guide us more about this in her presentation. And then for the first 3 months of implementation, so covering August to October, you will need to submit the first financial and technical progress reports. And these reports, together with the ethical clearance that you I'm aware that many of you have started working on, and the meal plan will be due on November 30. And for the reporting templates and requirements, Anna and Hala, who will present later, will give you more details, but also will share templates with you later in due course. Now, moving on to the subsequent reporting, there are also 3 key deadlines to also keep in mind. One is by February 28, 2027, you will need to submit the second financial and technical progress report covering month 4 to 6. So we have an error here in the table, it's month 4. And this is together with the asset inventory and disposal plan, which Anna will also introduce. And by August 31, 2027, you have the third reporting covering month 7 to 12. And this is also, if need be, to be submitted along the asset inventory and disposal plan. And finally, by January 31, 2028, you will need to submit the final financial report covering the remaining project expenditures and the final technical report covering month 13 to 17. And in this final report, we expect you have developed a dissemination plan and a plan for presenting at our regional conference, which will also give you more details about in due course, as well as the final asset inventory and disposal plan. So please, these are the deadlines to be remembered, and as part of our team, we will answer questions as well, but we will always remain in communication in terms of these deadlines, just to, for now, to keep them in your schedule, please. We'll now move into more details, financial and technical, with Mrs. Anna Hourani, who is the operation manager and the admin of March. Anna?
So, hi, everyone. I'm Anna Hourani. I'm the operations manager at the Nature Conservation Center at the AUB, and I will be responsible for the financial reporting of the sub-grantees in coordination with the Office of Controllers at AUB. So first of all, I would like to remind you about the country clearance. So my colleague Rauya did send you the country clearance procedures by email along with the sub-grant agreement. So if you can please, for those who didn't get the clearance yet, please make sure to secure it as soon as possible. Next, please. So we will going through the financial reporting. We will go through the payment schedule and conditions, the templates, the supporting documents, and the contact person in case you have any questions. Concerning the payment schedule and the conditions, we have in total 5 payments, as mentioned by Rawia. We have 4 financial reports. All the payments are based on the acceptance of the technical and financial teams, based on the reports shared by the subgrantees. And we have 1 month to proceed with the payment once we are satisfied with the reports. An invoice is needed to be shared with the deliverables, with the amount mentioned in the sub-grant agreement for every sub-grantees. So once you send all the deliverables, please make sure you attach also an invoice to be able for us to proceed with the payment. So now if you can please start and before the end of this week, maybe share the first invoice with the 10% amount, so that we can be able to proceed with the payment in due time. Next, please. Sorry, I have to say also that the last payment will be based on the actual expenses reported in the final financial report. So this is only to mention that all the payments will be based on the percentages we shared in the sub-grant agreement, but for the last payment, it will cover only the actual expenses, okay? Next, please. So concerning the conditions of the payments, for the eligible expenses, we will only be covering the expenses incurred during the project period. So all the expenses incurred before or after the project end date, we won't be able to cover them. For the report signature, all financial reports must be submitted to AUB and signed by the project leader and the chief financial officer. For the payment determination, the amount of the payments will be based upon an analysis by the March team of the accounted expenditures as well as the forecast submitted by the recipient. For the final payment, as mentioned before, the last payment is based on the actual expenses reported in the final financial report. Concerning the non-submission risk, failure to submit any final report by the contract completion date may lead to closing the project by the March team and also to withhold all future payments and immediately return any unspent and unaccounted funds. And for the budget reallocation, in case you need to do any budget reallocation from within the budget lines, you need to send us an email and secure the approval before proceeding with that. Okay, concerning the financial reports and the templates, so we will share with you the financial report templates for every financial report. So we will have in total 4, as I mentioned before. So you will see we have the categories, the budget categories, the initial budget for each category, the expenditures of the reporting period. So the first report will cover months 1 to 3. And then we ask you to fill the cumulative expenditures by period. So as you can see, we have months 1 to 3 and the total cumulative. So this is for the first period, for the first report. And then we will have the remaining balance. We also ask you to share both the Excel and the signed PDF version of the financial report. Next, please. So this is the second template for the financial report. As you can see, it's the same, but in the cumulative expenditures, we have the months 1 to 3, 4 to 6, and the total cumulative. Next, please. Same for financial report 3. And next, same for financial report 4, which will cover all the project period. Next. We will also be sharing with you a transaction list you need to fill it for each reporting period. So as you can see, it has a transaction date, reference number of the document, invoice, receipt, whatever, description of the document, budget category. Within the budget categories, personnel, equipment, consultancies, the name of the supplier, the amount, the currency of the amount, the exchange rate, you need to check Oanda. We will send you the link for the Oanda currency converter for you to add the amount of the invoice. And based on the date of the invoice, you will get the conversion rate to USD. And finally, the table will, and the last column in the table will be about the amount in USD. And similarly to the financial report, we also ask you to share the Excel sheet and the signed PDF of the transaction list. For the asset inventory and asset disposal plan, so only the subgrantees who will be purchasing IT equipment will be asked to fill this asset inventory and disposal plan. We will share with you the template also as well. So it includes the serial number of the equipment, the purchase date, the description, make plus model. So for example, HP ZBook, purchase value in Canadian dollars. So also you need to use Oanda to get this number. The location, it includes the country and the university name or organization name, the responsible person who will be using this equipment, the life expectancy of the equipment, the disposal date in case it's applicable, and also the reason for disposal. Next, please. Now, concerning the supporting documents, for all types of expenses, you are required to attach supporting documents to the financial reports. The supporting documents can be contracts and consultancy agreements, payslips and timesheets, invoices and receipts, proof of payments or bank transfers, and exchange rate documentations where applicable. So in case your invoices are not in US dollars, you need to send us screenshots to attach the screenshots of the Oanda website with the rate to the invoice or receipt or documentation, so that we can check that you are using the correct amount in the financial report. Please note that expenses without supporting documents won't be reimbursed. Okay, so please make sure to keep all the documents and to attach them to the financial report. Next, please. Okay, concerning the supporting documents for the travel expenses, you need to get back to us to get the AUB per diem. So you send us an email while preparing for the travel, you need to send us an email about the dates of the travel and the country you will be visiting, so that we can provide you with the AUB per diem for the hotel accommodation fees and for the meal and transportation fees. You can only use economic class tickets, so we won't be reimbursing any business class ticket. For the supporting documents required for travel expenses, we need the airline ticket, the boarding pass, proof of payments for all travel expenses, including the ticket, and the passport copy of the person, also including the control stamps. So we need proof that you went and visited the country. Next, please. So in case you have any questions related to financial reporting, please feel free to send me an email and copy the March team. You can find here the emails. Thank you.
Thank you very much, Anna. Over to Hala.
Thank you, Dr. Khader. Hello, everyone. So I will be discussing the technical reporting requirements. I will go over them in a fast manner in order to save time. So basically, throughout the 18 months of the project, you will be submitting 4 technical progress reports that build on the already existing progress that you have been implementing. So the reports must contain sufficient information for us to be able to determine the progress as well as the technical success of your projects. So first of all, the submission must take place using email sent to the main March email with CC to the March team, being Dr. Jirdi, Dr. Khader, myself, and Ms. Anna Hourani. For the formatting, specific concise formatting should be followed in these reports, including the margins, the font type, the size, especially the the number of pages being filled, in addition to the format submission. Quick disclaimer that in case of any failure to submit the required reports on time as indicated in the subgrant agreements, and unless agreed by the March and AUB team in writing, the team shall request a refund of the unspent portion of the grant for which there has been failure to report, and the team will be notifying the recipient in case of any omissions or clarifications needed for the report. So the technical report, this is a brief tentative outline for the report. We will be sending you detailed instructions in due time. So it's made up of 11 sections. The first of all is a title page and a table of content that should be concise enough for us to know any information regarding the team, the project, the submission date, and the region, followed by a one-page or a half-page executive summary of the key messages, advances, research findings, outputs, outcomes, and specifically the changes and conclusion for the next step in this reporting period. This is followed by the objectives that should be adequately described and show progress for each. Then we have the project implementation and progress that should be based on the timeline as per the work plan, that also highlights any changes done to the work plan and any key priorities for the upcoming period. As for the project management, an indication of the implementation, challenges, risks management, dynamic evaluation, the RQ Plus and scaling science approach should be highlighted in addition to the team composition. Regarding the gender equality and inclusion aspect, it should be included throughout the whole sections of the report and highlighted in this section specifically, where a reflection on the implementation of the GEI considerations, lessons, challenges, and insights, in addition to modification to the GEI approach, should be highlighted, and any progress related to the gender progress markers, in addition to examining any intersecting identities and experiences that contribute to the compounding vulnerabilities and potential discrimination. For the outputs and dissemination, the identification of the outputs that are in production but have yet to be completed should be highlighted. In addition, outputs that relate to information sharing, dissemination, manuscript, paper conferences should be highlighted and attached. In addition, the outcomes should be properly described. In addition to that, a proper analysis of these outcomes should be provided, taking into account the scale, social, gender, and environmental dimensions. For the learning insights, these insights should be gained throughout the project from reviewing and making sense of the monitoring and any other relevant data. Highlighting the application of the learning to your project is essential, in addition to how it relates to March, ARCH, and the broader relevance of the climate and health research landscape. In addition, any recommendations should be highlighted that could be related and directed to March, ARCH, with respect to the administration of the project based on any information provided in the previous sections. In addition, the output and dissemination should be highlighted and attached to the report, and any needed templates will be sent to you so you could fill them and attach them. Now we have the safeguarding and SHEA policies requirements presented by Dr. Jordi.
Hello again. So this is the part that we have to really stress on, safeguarding and the SHEA requirements. Before I move ahead, I want to reemphasize that don't worry about being bombarded with all this information, because remember that already you're mostly familiar with them. We have part of them have been communicated to you. Part is in the contractual agreement. All of them are in contractual agreement. And also, as we approach each of the deadlines, you'll get all the information that is needed to be able to complete the submission. So relax and take it easy. I think it's going to be a smooth journey, hopefully. So the March research team are considered the partners of the at AUB or we are the AUB partners in the Shia policies for which it applies. So any subgrantee indirectly is part of this process. So it's very important that I go through these requirements specifically for the team leaders to determine first the rights and responsibilities. So you have the right to participate in projects in a safe environment, respectful, free of sexual harassment, sexual exploitation, or sexual abuse. And the partners should create and maintain an environment which prevents the Shia. This is very critical. Mandatory reporters. AUB has designated all employees engaged in extremely funded project or research activities as mandatory reporters. So these individuals are obliged to report the actual suspected Shia to the Title IX coordinator. So we have a Title IX coordinator and it's an obligation. Next, please. So the reporting channels, if you ever experience or see unsafe behavior, or you feel, or you're suspicious, it's important to report it. You can report the concerns safely to the Title IX coordinator at AUB, and you have the phone number and the email. And for example, if you have a complaint box, which is at the project site, it can be helpful also that the principal investigator all the time checks it to see if there is complaints. Ethic Point online system, and the PI will forward your concerns to the Title IX. Unless there is a problem with the PI, then it's a different story. But hopefully there will not be any problems. So this is the regular process through the PI. Support and assistance. At AUB, you provide support, and it's confidential support. It includes access to medical, psychological, legal, gender-based violence services, while setting priorities for the safety, dignity, and the protection of all the individuals. So this is a highly confidential system, and you don't need to worry about that, and hopefully will not be needing to deal with such types of complaints. So the MARSH guiding policies on sexual harassment, sexual exploitation, and sexual abuse, you can scan the code and you have them. And also this has been communicated and will be recommunicated. And I think the last thing relates to an email that the principal investigators will be getting from the Office of Research relating to the checklist that they have to fill and accordingly comply with. So the signature of all members, just to emphasize, the signature, for example, as part of MARSH, the director, the management team, and all the steering committee and the advisory committee, all we had to sign the AUB policy review and acknowledgement form, which is the draft regarding the protection of beneficiaries and partners of AUB externally funded projects and research activities from sexual harassment and so on. So this is very important. And as I told you, expect an email with the checklist to be filled from the Office of Research.
Thank you, Dr. Jildi. So moving on to the communication and branding requirements. So each individual research team must develop a communication and dissemination plan by the end of the project. There is no actual criteria for this plan, but an overview or these inspiration points could help you think through this plan. So the first section could include the project background and introduction, followed by a brief communication and dissemination strategy, the target audience for the plan, and the detailed action plan. And this could also be followed by any procedures you have been following and adopting, any stakeholder engagement ideas, digital communication plans, and identity and branding guidelines. In addition, as part of the subgrantee's communication and dissemination plan, the project's identity and branding guidelines must be developed. These include following the March graphic standards to ensure a common projected image by utilizing the presentation and the reports templates that have been previously shared with you to the project PIs. Followed by that, the templates were also developed in a way where the lead institution's logo is to be incorporated along with the March logo. So on the left, we have the lead institution's logo, and on the right, the March logo will be incorporated, in addition to the funding agency's logos. In addition, any dissemination materials, outputs, publications must comply with the project's branding guidelines by including the required logos, disclaimers, and acknowledgements. These acknowledgements will be shared with you and have been previously been incorporated within the call for proposal template. So
thank you very much, Hala. So for the sake of time, we will be missing this section of Q&As. But again, we have that chat. If you have any questions, we can answer them there. We're already answering your questions. We'll move on to the next session, which is final. We'll try to be very quick here. And it's about the next steps and upcoming key deadlines. Hala?
Yes, so the upcoming deadline and the deliverable due date is August 31st. It includes the work plan, the risk management plan, and the open access and data management plan. In addition to the safeguarding checklist that Dr. Jurdi highlighted, will be sent from the AUB Office of Research. So keep an eye for that. As for the submission of these deliverables, it should be sent via email to the official March email with CC to the March team being Dr. Jurdi, Dr. Khudur, myself, and Ms. Anna.
Thank you so much. And just to say, and also very quick, that we are organizing a March Research Grant Management Series. And this is in collaboration with our research partner, the Center for Research on Population and Health, CRPH. And shortly, we will send you a survey where we would like you to fill it first by the PI, and we would also appreciate if you can share it with your research team, and then send it back to us to our email, March email. And this will help us tailor the capacity building program according to your needs. More information on that will be communicated, but just to say that it requires 10 to 15 minutes and it has 1 week deadline. So please do expect an email from us in that regard.
Thank you, Rawia. So moving on to the March website and the available resources on the website, we highly encourage you to access this website regularly. You could scan the QR code to be able to view it now. It's super easy to navigate and has super clear instructions. So an introduction to the March project is highlighted on the main page, the teams, the impacts, and the vision, followed by our research priorities and outputs, any resources that you may be using to be implemented throughout your projects, our publications, upcoming news and updates, the calls for EOI, keeping an eye out for the cycle 2 for the research projects, the SHEA policies, in addition to the contact information of the team. So we encourage you to specifically familiarize yourselves with the resources present on the website, being the ArcQ+ and the Scaling Science resources, as they are integral to be incorporated throughout your project. And we also recommend completing the Gender Equality and Inclusion online course, which represents a key component of the March approach to integrating gender equality and social inclusion into research in line with the IDIC guidance.
Okay, last but not least, opportunities for collaboration. So now we're part of all of us were part of the March family. And the March team will be organizing working group check-ins. The objective of these check-ins is to have an exchange. Meetings will be conducted every around 3 months. We're going to work together as a regional family group. to discuss our progress, share our concerns, challenges, and try to support each other, and also explore options for future collaboration. In addition, remember you're part of a global network, the ARCH, and as such, we're going to extend the collaboration to the other ARCH hubs. So more information will be shared with you about this initiative, which is very important and very critical in due time. So at one point, most of the information is going through the PI, and we hope that the PI will communicate it to the members of the team. So we're taking this for granted. So because we didn't have all the names, so we prefer to have it centralized through the principal investigator. Thank you very much. Hopefully we did not bombard you with lots of information, which we did. But the presentations took a little bit longer than what we anticipated, but they were really very comprehensive, and we didn't wanted to stop any presentation, because we wanted to learn more and more, although we really know about each project. So sorry for being 2 minutes late, beyond the time allocated, but we'll have other chances to detail everything that was really presented here. And you know that we have open channels, and you have experienced this by now with us, so we respond directly, and I have a golden team that directly respond, and if you have any concerns or questions, please let us know. So let's work together, let's make a difference, and hopefully this will be the start of an long time ongoing collaboration and successful one. Thank you for attending. And if you have, please, any questions, since we did not allocate lots of time for the questions because of lack of time, kindly send us the questions that you want, and we'll answer them directly.
Yes, and just to say, we'll send you the slides so you can keep them in your records. We'll also send you a summary of our discussion today. And again, we're open, we're available, and we're very much looking forward to be working with each one of you. So thank you.
And special thanks to Mr. Robert. Thank you very much for attending the whole session. And we have a very good team for Cycle 1, and hopefully we'll get another great team for Cycle 2. And we'll work together in order to enhance the resilience of primary healthcare systems to climate change, this major challenge to keep our planet safe. Thank you all. And hopefully we'll see you next time, not virtually. We can host you at AUB. So let's hope for
everyone.
Thanks, everyone.
Thank you.
Thanks. Nice to meet you all.
Thank you, and take care.
Thank you.
Thank you. Thank you.
Thank you.
الحين